An internationally known health and fitness pioneer, Dr. Kenneth Cooper has made outstanding contributions to the world of preventive medicine through his research on the relationship between exercise, health, and longevity. Cooper joined the Army after completing medical school, but soon switched to the Air Force to pursue a career in aerospace medicine. Cooper became the director of the Aerospace Medical Laboratory, tasked with creating a conditioning program for astronauts. But his interest in exercise was not only professional, but also personal. After gaining about 40 pounds, experiencing what he thought was a heart attack, and taken to the hospital, Cooper realized he needed to get healthy. While completing his Master of Public Health degree at Harvard, Cooper trained for his first marathon.
So during that first year, I started training for the Boston Marathon. This is back in 1962. And I trained and I ran the Boston Marathon. Happy to say that I had lost that weight, got back in shape. I never felt better in my life. And it just changed my life, changed my attitude, changed my profession.
In developing the conditioning programs for NASA, Cooper studied 27,000 people to create the aerobic point system, the 12-minute, and the 1.5-mile test, which are now standard all around the world. This research led to the publication of his first book, Aerobics, which touted the benefits of biking, swimming, and other aerobic exercises to the general public.
Our theory was, if those men and women work in the field get 30 points a week with one or more exercises, over a period of 6 months, there'd be a dramatic improvement in their fitness. That's exactly what happened. So a point system was verified while we're in the Air Force. And strange as that may be, the first book was published in 1968. That's the first of 19 books. And we now know, some 40 years later, that the points we recommended per week are almost exactly the same.
After leaving the Air Force in 1970, he opened the Cooper Aerobics Center in Dallas, Texas, and has since created a nonprofit research and education institute, a second aerobics center, and a residential community focused on wellness. Cooper even trained the Brazilian soccer team to a World Cup victory in 1970.
If you go to Brazil right now, they don't ask you, have you done your jogging, have you done your swimming, your running? They ask you, have you done your Cooper? And the Cooper test, we developed originally, a 12-minute test, is now the international test that they use for all the 119 teams under FIFA, International Football Association.
While he's been invited to speak all over the world, authored 19 books, and is called the father of aerobics, Dr. Cooper calls his family his greatest contribution to the world. Cooper has supported preventative medicine throughout his career and urges the military and the rest of the country to do the same.
The great future in medicine, modern medicine, is in the field of prevention. So we do feel that that's an aspect of medicine that we really haven't looked at.
Cooper is now focusing much of his time on the health of today's children by incorporating fitness programs in grade schools.
We're going to be changing this whole state starting in January 2009. We're preparing another bill right now, and we're going to go back and request big dollars, at least $50 million to put in the PE programs in Texas. Not zero as we put in 2007. Not a penny was put in the PE programs to try to improve them in 2007. But we're going to have the Coordinated School Health Program, which is 8 different things, including the school lunch program. That's going to be changed. We'll put more money in to get more PE teachers. We have 1,000 schools in Texas have no PE teacher. Certified PE teachers, less than 50% of the grade schools have certified PE teachers. A tremendous lack because there's no future for these people. That's why they've lost their jobs. We're going to change that. Because if we don't change that, we're going to lose this country.
At the age of 77, Cooper still works 60 to 70 hours a week and follows the same advice that he gives to others on staying active.
So I did try to follow my guidelines I've written in the book since 1960. I have followed those guidelines. Got my weight down, don't smoke, don't drink, all those various things. And so I do think that that's enabled me to keep working as I'm at the present time.
Cooper cherishes his military service and recognizes the key role it played in his success.
But I would say, looking back, I have nothing but good thoughts to say about my military career. Because if I hadn't done that, stayed in the service, and then had that chance to work with this large number of people, the world would not have the aerobics program. We still wouldn't be using exercise and practice of medicine because no one was doing at that time what we're doing now.